Hello, this is Lee, licensed acupuncturist and herbalist, and today I'd like to introduce some acupuncture for balancing the muscles and tendons around the hip. And I have a gentleman who had hip replacement on both sides, and it's not very successful initially, but then he had a revision surgery the second time, which make the hip function better, but he still has some achings if he walked too much or standing for a longer time, because after you had a surgery, the muscles around the hip joint is weaker, and we're gonna show where the hip surgery is, and you can see the big scar tissue and the muscle has a little indentation there. And by doing acupuncture periodically, and we not only making the muscle and tendons around this artificial joint more balanced, so it won't put too much pressure on the joint, but also the needles can help build stronger muscle. So when you have stronger muscle and tendons, the joint will be holding in right position instead of the moving around when you stand for a longer time. So if you had the hip replacement, or you still have your own joint, and then you like to make the muscles and tendons around the joint stronger, you can have acupuncture once or twice a week. And once the muscle gets stronger, you can reduce to once a month. That way you won't have joint pain. You can walk longer, standing longer, keep your hip joint function better for a longer time until you reach 100 years old. So let's look at this joint. So this is the hip joint, and we can see there's a big scar here. So the hip socket and the femurs, part of the femurs, are metals. So you see this big scar, and the muscle is has a little indentation here, and so we put needles around here to try first stretching those muscles, and then later we can put on the electric stimulation here to make the muscle stronger. So first relax and balance, and then strengthen the muscle. And that way this gentleman can play golf more than 8 hours in the future without pain. And the other thing is, see the back muscle here, when this gets very tight, it can also pull the muscle here and causing the hip joint not in a perfect balancing condition. So if we do the needles here, we also want to loosen up the back muscle. That way it won't put too much pressure around hip joint. So balancing the back and strengthen your hip muscle, and the function of the hip, either artificial joint or your own joint, will function longer and better. So if you want to have more information about how we can make our joint working properly until we reach 90, 100 years old, and you can go to my website, www.bostonchineseacupuncture.org, and see what kind of points you can press combining acupuncture to make your joint function the best.